Hello, I'm Joan Justice from HealthWorks Collective, and I'm here today with Dr. David Delaney, the Chief Medical Officer for Healthcare at SAP. Dr. Delaney has a background in medicine, information technology, and business, and I asked him here today to talk to us about how SAP can manage big data to help physicians find ways to optimize patient care. Dr. Delaney, why don't you tell us a little bit about what SAP does to improve care quality for patients and reduce costs?
Absolutely, and let me start out by saying thank you, Joan, for having me on and giving this opportunity to talk to your audience. When you look at what SAP does, you really have to start at the foundation because that's where many organizations struggle. When you look at your typical, if there is such a thing, medical center or healthcare system, they have a variety of systems. Often they'll have a number of different EHRs in place. They'll have different financial systems. And so it's a real challenge for them to be able to pull that information together in a way that makes sense to apply data governance to it so that a length of stay is the same at one institution or one section as another section, and really make all those definitions standard so you have a set of trusted data. So that's one of the first steps that we help organizations with. And then on top of that, creating a semantic layer, which basically means changing those cryptic terms often within systems for individual fields into terms that make sense for business and clinical users, so that if a nurse or a business person looks at it within an organization, the field names all just make sense to them in terms of what they are. They trust that the definition underneath is true and accurate, and they're able to begin to self-serve and create their own queries, ask their own questions of the system and get answers back, and to begin to more effectively manage around cost and quality for the organization. And be able to do that not only within one institution, but across multiple institutions, across inpatient and outpatient. So that foundational layer is very, very important, and it's one of the things that Business Objects does extremely well.
Okay, so you take all this raw data and the clinical and the financial, and you analyze it, sort it, and help it make sense to the healthcare professionals and providers.
Exactly, and we pull it into basically a standardized data model. And then from on top of that, you have all your analytics that can run and help institutions better understand what's going on. You can create things like dashboards available via web applications, via mobile devices, your iPad, your iPhone, Android device, so that it's consumable wherever folks are to help them make better decisions as they're going throughout the day.
Okay, so you also facilitate seeing the EHR on mobile applications, tablets and phones.
Yeah, and that's one of our newer pieces of that, because in the past we've been very focused on the analytics piece, and one of our main ways to market actually is that we're embedded in most of the leading EHRs as their reporting and analytic tool, and so we within the sandbox of the EHR reporting tools there. Often as organizations then want to go broader than that, they want to begin to pull in financial information and information from other EHRs, other systems, then they will go more broadly with business objects and get something that, again, that can create that foundation. On top of that, one of our more recent to market is called the EHR Wire. And that's basically a viewer for EHRs that gives them mobility, helps communication occur more easily between providers, so that providers who are actually at the hospital can communicate remotely with specialists who might be outside of the hospital and collaborate around cases. They can both see the same data set represented in the same fashion and discuss a case and determine best course of action. It can take multiple EHRs, so maybe you have a different inpatient and outpatient EHR, and it provides this between institutions or between EHRs. So it's one consistent way to browse and view the data in a mobile fashion and really speed up and enhance communication, which, as you know, with your nursing background, time is hard, it's brain, depending on what the patient's coming in with. Time has a tremendous amount of value, being able to collaborate, bring the experts together, no matter where they are, at a moment's notice to make a good decision and begin to execute on it. All those things help lead to better care.
Yeah, sure. Absolutely. I understand. It also says on your website that you improve preventative care. Now, how does SAP do that?
Yeah, absolutely. So one of the things we're very excited about is that we work very closely with not only the leading folks on the provider side, but also on the payer side. And when you look at that have been in place over the last decade or so in the care system, the payers have great knowledge around populations, defining populations, doing risk stratification, determining who's at the greatest risk for an event to occur. They're very good at that. And then you look at the provider side, and on the provider side, we're very good at seeing individual patients, providing care. A patient comes with a problem, figuring out what it is, and taking care of it. But we're kind of limited. Our view of the world as physicians and nurses is really around the patient in front of us, who the next patient through the door is, or who the next patient around is. And we really don't have a very population-based knowledge to kind of know who is likely, where the wheels are likely to come off the bus, which patient. Mm-hmm. And so taking that information that payers know so well around population and risk stratification and providing ways for practices to visualize it, to better understand within their patient panel, who is likely to have an issue this year and what can be done. And so really providing them this lens or this filter to see who the sickest of the sick patients they're caring for, who's at risk, and what can be done to help prevent that thing from happening, and making it all actionable and easy for them to digest and consume.
Great. Well, thank you so much for this, David. You've really shown us how SAP can help with controlling costs and raising the quality of care. I thank you for the interview.
Thanks so much, John. I appreciate your time.